Pigmentation, removal operation. Before operation, we have to do skin test because the nature of each customer's skin and the type of pigmentation are different. So we adjust the corresponding parameters to carry out a skin test. After the test according to the customer's skin reaction and then add or subtract energy, adjust the diameter of the light spot. Because there is a lag in skin reaction, wait 1 to 2 minutes after the test of different parameters to observe the condition of the skin. According to different types of pigmentation, there will be different skin reaction thresholds. For beginners, it is recommended to hold the treatment head close to the skin because the distance pulling up will reduce the diameter of the spot. It is recommended to familiarize with the principle before trying to pull up the operation. Freckles. Recommended starting parameters for freckles 1064 or 532 wavelength, energy 1.5, spot 4 to 5, frequency 2, 3 times a treatment course, once a month operation. Freckles are point-like epidermal spots. It is recommended to use small and medium light spots, point-to-point blasting. Do not break the skin to beat the blood. The skin threshold is slightly white without breaking the skin. There is also the option of doing the lightest whitening with the 532 wavelength. Sunburn. Recommended starting adjustment parameters 1064 or 785 wavelength, energy 1.5, spot 4 to 6, frequency 2 to 5, 3 a course of treatment, once a month. The operation of sunburn is close to freckles. The only difference is that the size of the sunburn is not uniform freckles. When faced with different sizes, different shades of color and sunburn, to be based on large patches, the light spot is appropriately adjusted upward, and small particulate spots are adjusted downward. Darker colors can reach white without breaking as a threshold, and lighter colors can reach reddening. Freckles may be tuned with one parameter to operate on the whole face, and sunspots may be tuned with multiple parameters corresponding to color, area, and location. Age pigment. Suggested starting parameters 532 wavelength, energy 1.5, spot 5 to 7, frequency 2, 3 times a course, once a month operation. Age pigment are epidermal and a 532 peel program is recommended, with the caveat that during the operation, the color of the spots is not uniform. Brown and black color is heavy white, light brown spot is moderate white, light coffee color is slightly white. The purpose of this is to take care of the peeling depth to match the depth of superficial melanin, and use a closed moisturizing treatment to keep it moist. You can apply Dasiv oil cream with Dasiv serum to inhibit melanin. Chorea plaque. Suggested starting parameters 1064 wavelength, energy 2.5, spot 5 to 6, frequency 4 to 6, 5 times a course, 1.5 months operation. The 1064 wavelength is the optimal choice for chorea plaque because the longer the wavelength, the deeper the penetration. It should be noted that for the control of skin lesions, we suggest that the skin redness and subcutaneous hemorrhage as a critical value. Chloasma. Suggested starting parameters for chloasma 1064 or 785 wavelength, energy 3, spot 6 to 7, frequency 6 to 7, 5 times a course, 1.5 months operation. Chloasma is categorized as pigmented, vascular, and complex. For the pigmented type, a large spot is operated until the skin is reddened as the critical value. For the vascular type, you can't use lasers to aggravate the inflammation and irritation of the skin, and it is recommended to use toning. For composite, it is especially important to note that flaky spots cannot be operated with a point-to-point regimen because the composite has a vascular type of spot and can only be done as a dotted, superficial spot. Usually panning is the best option for chloasma, and the core of panning is evenness, and the core of evenness is many times. The accumulation of the number of operation will increase the temperature of the skin. The ice pack process is preoperative, intraoperative, and postoperative. Ice it right. after doing part of it. Complex spot. Complex spot recommended starting. Parameters 1064 or 785 wavelength. Energy 3. Spot 6 to 7. Frequency 6 to 7. 5 times a course. Once a month operation. Complex spots may be compounded with spot and sheet, epidermis and dermis, stable and unstable spots. The cuticle is thick. The critical value can be done a little heavy. The cuticle is thin. Do a little light. If you are concerned about uncontrollable risks, large spot panning is the best option. Be careful not to break the skin and bleed. Post-inflammatory hyperpigmentation. Suggested starting. Parameters 1064 or 532 wavelength. Energy 2. Spot 5 to 7. Frequency 3. 3 times a course. Once a month operation. Most post-inflammatory hyperpigmentation metabolize themselves back over time. If a case of post-inflammatory hyperpigmentation hasn't fallen off after a year or two, consider the 532 wavelength peel method. The best feature is that it is more efficient. The disadvantage is that the restoration cycle is longer. If the client wants a shorter restoration period, we recommend the 1064 wavelength metabolic program for greater safety. The core is that the threshold is the lightest degree of whitening. Postoperative care.